Have you ever been told you have a positive rheumatoid factor and immediately feared the worst? Let's clear up the confusion. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge, thoughtful care. Today, we're talking about a lab test that causes a lot of anxiety and confusion, the rheumatoid factor. What does it mean if yours comes back positive? Does it mean you have rheumatoid arthritis? Do you need medication right away? Or is it something more subtle? This is a key topic, especially if you've had joint pain or your doctor has run some blood tests and now you're wondering what it all means. Let's break it down in a simple and clear way. What is the rheumatoid factor? The rheumatoid factor, or RF, is an antibody. Antibodies are proteins your immune system normally makes to fight off viruses and bacteria. But with the rheumatoid factor, something unusual happens. Your immune system starts producing antibodies that targets your own antibodies. That's right. Your immune system starts attacking itself. In this case, the rheumatoid factor targets a type of antibody called IgG. When it binds to IgG, it creates immune complexes that can get deposited in your joints. These complexes trigger inflammation, which is what leads to pain, swelling, and damage in rheumatoid arthritis. Here's the key. The rheumatoid factor isn't the cause of rheumatoid arthritis, it's a sign that your immune system is misfiring. And just because someone has a positive rheumatoid factor in their blood doesn't mean they definitely have RA. In fact, some people have a rheumatoid factor and never develop any symptoms. And some people with rheumatoid arthritis may not have rheumatoid factor at all. That's called seronegative rheumatoid arthritis. In fact, up to 10 to 15% of healthy people can test positive for a rheumatoid factor and feel perfectly fine. That's why the rheumatoid factor is not a diagnostic test on its own. It's one small part of a bigger puzzle. We don't know exactly why the rheumatoid factor starts to develop in some people, but we do know that genetics, infections, smoking, and other immune triggers likely play a role. The bottom line is that the rheumatoid factor is one piece of the puzzle, but diagnosis and treatment decisions need to consider your symptoms, examination findings, other labs, and imaging. That's why I always emphasize a comprehensive and personalized approach. Your lab tests are important, but they never tell the full story on their own. So doctors check for a rheumatoid factor when they suspect a person may have rheumatoid arthritis, a type of autoimmune arthritis that causes joint swelling, stiffness, and pain. It helps build the case for a diagnosis, especially combined with symptoms like morning stiffness or joint swelling and pain, physical examination findings that show inflammation in the joints, imaging results like ultrasound or MRI that also confirm inflammation in the joint, and other lab tests like the anti-CCP antibody, C-reactive protein, and SED rate. But remember, one test alone doesn't give us the full answer. Let's talk about what a positive rheumatoid factor could mean. It could be rheumatoid arthritis, especially if you have the right symptoms and other supporting labs. It could be another autoimmune disease like Sjogren's syndrome or lupus, where the rheumatoid factor can also show up. It could be an infection like hepatitis C or tuberculosis, or it could be nothing. Some people test positive and never develop an actual disease. So if your test is positive, but you feel fine and have no other signs of inflammation, you may not need any treatment at all. This is where clinical judgment really matters. If the rheumatoid factor is a general marker, the CCP antibody is the more precise one. CCP stands for cyclic citrullinated peptide. It's a more specific antibody for rheumatoid arthritis, meaning if it's positive and if you have symptoms, there's a higher chance you truly have the disease. Some people are rheumatoid factor positive and CCP negative. Others are CCP positive but rheumatoid factor negative. And some are positive for both, which may suggest a more active or aggressive form of rheumatoid arthritis. Let's address a few myths. A positive rheumatoid factor means I definitely have RA. Not true. It depends on the context and your overall clinical picture. Myth number 2, a negative rheumatoid factor means I don't have RA. Also false. About 25 to 30% of RA patients have negative rheumatoid factor. Another myth, I need treatment just because my rheumatoid factor is high. You only need treatment if you have other signs of active inflammation. If your rheumatoid factor is positive, your next steps depend on the bigger picture. Do you have symptoms like morning stiffness, joint pain, or fatigue? Are there findings on your physical exam or imaging that suggest joint inflammation? Are your inflammatory blood markers elevated, like the CRP or sedimentation rate? If those other pieces line up, you definitely need to see a rheumatologist and consider treatment. But if everything else is normal and you're feeling well, it's okay to just monitor things over time. I tell my patients, your labs are a piece of the story, not the whole story. So when should you be worried? You should be more concerned about a positive rheumatoid factor when you're having significant joint pain symptoms, especially morning stiffness that lasts for more than an hour. You're noticing swelling or warmth in multiple joints. You have unexplained fatigue, weight loss, or low-grade fevers. Your lab tests show inflammation or a CCP antibody. In those cases, early diagnosis and treatment makes a big difference. That's how we prevent joint damage and preserve your quality of life. If you have early aggressive RA and delay treatment, you risk permanent joint damage, long-term disability, higher risk of heart disease, and other complications. But if your case is mild or unclear, it's reasonable to monitor, make lifestyle changes, and reassess regularly. Again, it's about understanding the full picture. In my practice at Chicago Arthritis and Regenerative Medicine, I always take a comprehensive, nuanced approach. I look at the whole person, not just one lab test. I consider conservative treatment first when it makes sense. I use advanced imaging like diagnostic ultrasound to spot early inflammation. And I believe in shared decision making because you deserve to understand your options and feel empowered. So what does a positive rheumatoid factor really mean? It means your immune system may be making extra antibodies, but it doesn't automatically mean you have rheumatoid arthritis. Context is everything. If you're having symptoms, you may need further evaluation. But if you're feeling well, it might just be a lab quirk with no consequence. Always speak with your doctor and ideally a rheumatologist to figure out what makes the most sense for your unique case. If you found this helpful, make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. If you want to get evaluated or need a second opinion, give us a call, email us, or contact us via any of our social media channels. Until next time, take care and live well.